Hey, you guys, welcome back for another daily practice question. As always, I like to get into my introduction and disclaimer before starting our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, courses, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I have been doing this since 2015, helping nurses and nurse practitioners internationally with exam success, and I would love to work with you guys as well. I always like to get into a disclaimer before we get started, remembering that there's no absolutes in medicine. We treat on a patient by patient basis, and any questions that I provide are designed based on the current guidelines being tested on the ANCC as well as the AANP. And if I'm teaching on any practice guidelines or things that we're doing currently, I will tell you so there's no confusion. But with that being said, let's get into question number one for today. Question number one states, a patient presents to the office today with complaints of left lower quadrant abdominal pain and cramping. The patient has a history of diverticulitis, and the nurse practitioner notes that this is an acute flare-up. Along with medical management, what diet should the nurse practitioner recommend? Is it a high fiber diet, B, a high fiber diet and clear liquid diet, C, clear liquids and a low fiber diet, or D, the DASH diet? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first so that it slows you down and allows you to focus and realize if you're even answering what they're asking you in this question. So here, the stem of the question states, along with medical management, what diet should the nurse practitioner recommend? So, we got to take it back, see what we're even treating, what is the diagnosis, how are we proceeding? So the patient came in complaining of left lower quadrant, abdominal pain and cramping, classic presentation for diverticulitis. They already have a history of diverticulitis, and the nurse practitioner notes that this is a acute flare up. So would you give them a high fiber diet? No. High fiber diet and clear liquids? Mm-mm. Your best answer is C, clear liquids and a low fiber diet. Although you can advise for a high fiber diet for a patient with a history of diverticulitis when they are not in a flare up. Um, Guidelines have shown originally they were saying that you don't want to give this because they thought it may trigger their symptoms, but guidelines have shown that that's not proven. So patients with diverticulitis have a history of potential constipation, diarrhea, things of this nature. So they do recommend like your whole grains and things to kind of help along when you're not in a flare up. But if the question states that this is an acute flare up, you want to give that GI system rest. So they need to do clear liquids and a low fiber diet. So C is your best answer. All right, question number two for today. The nurse practitioner and NP student are discussing testicular torsion and friend sign results. What is an appropriate response to friend sign results that would confirm a diagnosis of testicular torsion? Is it a negative friend sign, B, a positive friend sign, C, friend sign is not a confirmatory test for testicular torsion, or D, a partial friend sign? Take a moment and tell me what you got. All right, so stem of the question states, what is an appropriate response of friend signs results that would confirm a diagnosis of testicular torsion? And this is one of those knowledge-based questions. So your answer here is a negative friend sign. Now, remembering that, and I know often this is confused, but with epididymitis, they have a positive friend sign. With testicular torsion, remember that spermatic cord is twisted. The friend sign, lifting of the testicles, is not going to relieve that pain, so it's going to be negative, and that will confirm that diagnosis. This is an emergent case, so you need to refer out so they can get surgery. All right, and lastly, question number three for today states, a patient presents to the office for follow-up today. The patient denies any complaints at this time. She has a history of seasonal allergies and chronic kidney disease. Upon examination, the nurse practitioner notes a blood pressure of 146/88 today. The patient has attempted lifestyle modifications. She also mentions that she is allergic to sulfa medications and angiotensin converting enzyme inhibitors. Based on these findings, what is the best treatment for the nurse practitioner to prescribe? Is it A, lisinopril, B, chlorothalidone, C, losartan, or D, amlodipine? Take a moment and tell me what you got. All right, stem of the question states, based on these findings, what is the best treatment for the nurse practitioner to prescribe? When we're talking treatments, I always tell you to run it back and see what the assessment is, what the diagnosis is, and then see how to proceed. So the patient came in just for a follow-up. She denies having any complaints or issues. She has a history of seasonal allergies and chronic kidney disease. The nurse practitioner notes a blood pressure of 146/88, so we know that that is elevated. They've already attempted lifestyle modification, so we're at the point that we need to prescribe a medication to manage her blood pressure. She's allergic to sulfa medications and angiotensin converting enzyme inhibitors. So, knowing this, how do we treat the blood pressure? Is it A, lisinopril? You should immediately eliminate that because she is allergic to ACE inhibitors. Remember, ACE inhibitors end in pril. B, chlorothalidone. We usually do go thiazides first line therapy, but remembering that this patient has a history of chronic kidney disease, so we want to look for the medications that are going to help protect the kidney. So, typically we're going to go with an ACE or an ARB, and in this case, the ARBs are the best route, and they have an ACE inhibitor allergy, so you want to go with C, losartan, remembering your endings so that you know your medications. Sartan, SARTAN, are the endings for ARBs. And then amlodipine is a calcium channel blocker, and you can use that with patients with chronic kidney disease, but that is typically the next line therapy. So, say you're using an ACE or an ARB, and they need another treatment added on because the blood pressure isn't still managed, then a calcium channel blocker is a good next option to add on. But for the best treatment of first line therapy in this patient scenario, C, losartan is your best option. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. If you need any of our services, need any assistance preparing for boards, if you need if you prefer self-paced courses that you can do on your own and at your leisure, we offer an online self-paced course that is $89.99 monthly. It's on a subscription. You can stop at any time. If you just need a review book, we have an ebook option as well as a paperback option that is shipped to you. And it is broken down by system on each condition in that format that I always teach on: the assessment, diagnosis, evaluation, treatment. Then it has the level 2 of the area that, based on that system, it works through an interactive section, just short answers so that you're able to fill in that information based on it. And then it's a quick little med reference for the system as well. And then there's practice questions in the back with rationales. Again, there's an ebook option and a paperback option. And then lastly, our one-on-one sessions. If you have a particular weakness that you want to focus in on, such as like if you're struggling with anemia and you just want to book a session to focus on that area to make it a strength, that's an option. And then our most common option of the one-on-one sessions are the custom packages, where it's designed based off of your needs. You receive a pretest to see where you are, engage how you're doing, and then studies are structured in the time frame that you have to work towards your next test date, where we work to take you from being unsuccessful to successful, and we have 100% pass rate on that since 2015. But if you need us, give us a call at the Nursing Studio at 803-400-6864, or shoot us an email at the nursing studio, the number 1 at gmail.com. All right, you guys, happy studying. Bye, y'all.